Hi, I'm Dr. Priya Raju. Congratulations, you're expecting. It is totally normal to feel nervous, excited, and possibly even a little overwhelmed. We're here today to talk to you about what to expect at your first prenatal visit and also genetic screening options to help best prepare you for that first visit. When you come in for that first visit, we start with a usually transvaginal ultrasound to look for pregnancy and make sure, one, that there's only one baby in there, perhaps more than one, and date your pregnancy so that way we can give you an accurate due date. After that, you'll meet with one of our providers where we'll review your health history, go over what to expect for the pregnancy, and answer any questions you have. During that visit, we also typically do a pelvic exam and get a pap smear if you are due for one. After that, we do a blood panel to look for a number of prenatal screening tests. This includes your blood type, blood counts, and we screen every woman, every pregnancy for HIV, hepatitis B and C, syphilis, and rubella. In addition, we do discuss additional screening tests. Some of these are screening tests for your status as a carrier for genetic abnormalities, or in addition, we offer screening tests to test for chromosomal abnormalities for baby. The first two tests that we're going to talk about include carrier screening tests. This means, are you a carrier for possible abnormalities such as cystic fibrosis, which is a condition that can affect the lungs and digestive tract, or spinal muscular atrophy, which is a condition that affects our muscular development. If you are tested and are found to be a carrier, we would then recommend that the father of the baby also be tested, so you would know if you are at risk for carrying a child with these conditions. In addition, there are some genetic screening tests that look for conditions such as Down syndrome. These tests look for chromosomal abnormalities. Some of these are inherited conditions and others happen during the development of baby. You've probably heard of Down syndrome, which is something called trisomy 21, where we have an extra chromosome and that can lead to many different physical and developmental challenges. In addition, there are two other chromosomal abnormalities, trisomies 13 and 18, and something called Turner syndrome that can be assessed as early as 10 weeks, but we can screen throughout the pregnancy. As early as 10 weeks, we can recommend something called the non-invasive prenatal test, or maternity 21, which is a blood test, meaning it has no risk to baby. The neat part about this test is we draw mom's blood and we find baby's DNA that's floating freely in the bloodstream to assess for these chromosomal abnormalities. It has a very high detection rate, up to 99% for trisomy 21 or Down syndrome. And in addition, it also looks at the other chromosomal abnormalities, but also the sex chromosomes, meaning we make sure that baby is developing well, but you can also get the bonus information of if you're having a boy or a girl. After that test is done, in the 15th to 21st week of pregnancy, there is another test called alpha-fetoprotein, which is a blood test that looks for what we call open neural tube defects, or defects of the spinal column in development. If you have opted to not get the maternity 21 or non-invasive prenatal test, there's another test that is less commonly used now, but it's called the Tetra screen, which is a blood test that looks at 4 different markers and can look at the chromosomal abnormalities, but has a slightly lower detection rate, about 85%. Now, this is a lot of information, and you might wonder whether any testing is the right option for you. Know that there's no right or wrong answer, and everyone makes their own decisions. Some people do this testing because they want to be best prepared, whether it's from an emotional standpoint, and also from a care team standpoint, it helps us prepare from the pediatric side of things on knowing what to expect and for planning for delivery and what happens after. Some other people may decide that raising a child or going through a pregnancy with these abnormalities may be too much and may desire to terminate their pregnancy. And other people decide that sometimes they will not change their decision making, so this testing is not necessary for them, or perhaps would provide too much stress to undergo this testing, so they opt out altogether. And know that, again, any of these options are available to you, but there's no right or wrong answer. All of these that I've mentioned so far are screening tests, meaning we look, but doesn't mean necessarily something is wrong, even if you do test positive, because occasionally there are false positives or even false negatives. So in addition to all of the blood work that we've mentioned so far, we do a full ultrasound at 20 weeks, and that is a very exciting visit because you get to look at baby's development from head to toe, but we do make sure that baby is growing, developing well, and if anything is noted at that time, we would discuss that further and discuss options of further testing. If any of these screening tests come up abnormal or we catch anything on ultrasound that is worrisome, then we may recommend what we call diagnostic testing. These are invasive tests that are done as early as the second trimester, but can be done even later in pregnancy. And they involve either taking a small sample of the placenta or the amniotic fluid that surrounds baby. With these tests, we would have a thorough discussion with you, and we do have a maternal fetal medicine specialist and genetic counselor available to answer any questions you have. So feel free to kind of rewind and look through this video as many times as you need to kind of look over these testing options, and know that we're going to talk about all of this again at that first visit and have ongoing discussions. With regards to preparing for the visit, there's also a great number of information on the Baby Scripts app, so feel free to look at that as many times as you need to. And it's also helpful to write down any questions you might have before you come in for visits so that we can best address them during your visits. And just know that even if you forget something, you can always message us later or give us a call if needed. But hopefully this is helpful for you. And again, feel free to let us know if you have any questions or concerns. But we appreciate you trusting us with your care, and we look forward to helping you navigate through this pregnancy.